Hi, it's Michael Senoff with Michael Senoff's HardToFindSeminars.com. The title of this interview is called How to Stop the Baby Blues from Turning Dark and Scary. It's what every mother-to-be needs to do to prevent postpartum depression. Postpartum depression can hit any new mom. It's not hereditary, and there's no real determining factor to let doctors know who will get it and who doesn't. This scary disorder can turn even the happiest of women into shells of their old selves, lost, scared, and guilt-ridden with frightening thoughts they have no control over. Dr. Shoshana Bennett says that not only do these women deserve to be happy, with the right action plan in place, they will be happy. And in this short audio interview, you'll hear all about this horrible disorder that strikes 1 out of every 6 new moms and the wellness strategy that can stop it. You'll also hear common symptoms to watch out for that will let you know when normal baby blues has crossed the line. You'll learn the #1 life-changing thing partners can do if they suspect a new mom has postpartum depression. You'll learn the startling discovery that certain kinds of therapies actually make this disorder worse, and which ones should have any depressed new moms running in the opposite direction if they come across it. You'll learn about dangerous risk factors you'll want to avoid when pregnant that could send you over the edge, and you'll learn a real-life look at the worst-case scenario if this disorder goes untreated. Dr. Bennett knows how frightening postpartum depression can be because she went through it herself back at a time when there was very little known about the disorder. That experience drove her to research it herself, and now she says women can recover more than 100%. After the right treatment, they can actually expect to have a better self back. And in this audio interview, you'll hear all about the wellness plan that will get you on the right track. Now let's get going.
Hi, this is Chris Costello, and I've teamed up with Michael Senoff to bring you the world's best wellness-related interviews. So if you know anyone struggling with their weight, with cancer, diabetes, ADHD, autism, heart disease, or other health challenges, please send them to Michael Senoff's HardToFindSeminars.com. Dr. Bennett, thank you so much for joining us today.
It's my pleasure, Chris. Thanks so much for inviting me.
So you're the go-to expert on postpartum depression.
Well, I have often been referred to that way. And, you know, I've been in this field now for over 20 years, and this came directly from personal experience. I mean, I never thought I'd be one to go through this myself. I didn't even know what it was called back in the 80s, but it is so satisfying to be able to help new mommies and expectant moms to avoid what I went through, which is 2 devastating, life-threatening postpartum depression. So I love what I do. I've got the best job in the world.
How do you prepare for the possibility of dealing with postpartum depression?
Wonderful question, because I'm all about prevention, as I know you are. There is so much that we can do to help avoid, sometimes totally prevent, a postpartum depression, at least minimize the condition. So the first thing to do is, if you're doing well in pregnancy, some women are not. This hits the same percentage of pregnant women as it does postpartum. But if you're doing well in pregnancy, certainly you still need a wellness plan. Every expectant mom needs a wellness plan. So that includes exercise, something to oxygenate her brain. It doesn't have to mean going to the gym, but some kind of movement if possible. It includes excellent nutrition. We know in the research there are specific nutrients that feed and boost our mental health. Omega-3 fish oil is one very important one, and we could do a whole show on some of the other nutrients that we now know helps to keep moods even. Eating protein throughout the day, keeping the blood sugar even, can also help to keep moods stable. Who's going to be feeding the mom? Who's going to be bringing her food? Who's going to be in charge of that nutrition? Also, nighttime sleep. Often couples aren't even talking about who is going to be on duty when the baby comes. So having some kind of plan of action to make sure that mom is getting some uninterrupted hours of nighttime sleep, which can certainly help to protect serotonin in her brain. Serotonin is one of the most important mood regulators, the neurotransmitters in charge of mood stability. So these are some of the key elements. Certainly emotional support. Who is going to be there for her to lean on, for her to talk to? And physical support. Who's going to be there to give her regular breaks away from her child or children and the home so that she can nurture herself and she won't get lost in the shuffle. So even without a history of depression or previous postpartum depression, every mother-to-be needs to have a plan of action in place so that she can help to ward off any possible mood disorder. Well, as a new mother, certainly if she's had a history of depression, or most definitely if she's had a previous postpartum depression, she's at about an 80% risk of having another one without a wellness plan. So it's very, very important that that's in place if she knows she's high risk. I should say, though, that your listeners should know that no one is immune. Even if there's no family history or personal history of depression or other mood or anxiety disorder, anybody can get hit. It's like a roulette wheel. You know, we never quite know what's going to happen after delivery. But most definitely, if she has symptoms that are getting in the way of her daily functioning, in other words, it's very normal to have baby blues. Uncomfortable, but mild symptoms of vulnerability, of feeling dependent, weepiness, those kinds of feelings for a couple of weeks. But if it keeps going, even if the symptoms are mild, if week after week after week she is still feeling the blues, we now call it postpartum depression, and she should absolutely get some help. The other way we can tell the difference is if the severity of the symptoms are getting in the way, as I said, of her daily life. So if she is unable to sleep at night when her baby is sleeping, that is a big red flag. So any kind of insomnia, she has trouble going to sleep or staying asleep even when her baby is sleeping, she should get help immediately. If she is feeling angry or short-tempered, if she's very anxious, if she's obsessive, scary thoughts going through her head, disturbing thoughts to her, if she has very low self-esteem, if she's saying things and thinking things like, I don't deserve to be a mother, the baby would do better without me, my husband is a better father, those kinds of feelings of my baby's rejecting my milk, those types of feelings are not normal for new moms. So loved ones should be on the lookout for hearing things like this. If she has appetite problems, especially a loss of appetite, that's another warning sign. So there are a number of very common symptoms that we should be watching for and can alert us to whether or not this is normal or it's over the line and she really needs some intervention. The partner can make such a difference. Loved ones, even if there's not a partner, but just close loved ones can make such a difference in her recovery. Sometimes she knows there's something wrong, but she might be ashamed or embarrassed, or if she doesn't want to come forward because she's thinking, if I need help, that means I'm some kind of a failure. I'm inadequate as a mom. So she doesn't come forward. She just tries to put on a happy face and pretend. The best things that loved ones can do, especially partners can do, is say, you deserve to be happy. This happens to the best of moms. Would you like to talk to somebody who's been there? This is not your fault. You're an excellent mom. I'm behind you 100%. Let's get you proper help and do whatever we need to do to help you feel happy. You deserve to be happy. Those kinds of statements can make really a huge relief to her. If she gets defensive, a lot of people are afraid of saying something to a mom when they know she's suffering because they're afraid she's going to be upset. Well, if we think about it, when do we get defensive? We get defensive when we think we're being accused of something negative. So if she thinks that having postpartum depression means she's not a good mother, she's not capable, she can't handle it, then she might get defensive. But if you approach it just very matter-of-factly and say, you look like you're stressed, and, this happens to 1 in 6 women, 15 to 20%. This happens to the best of moms. Let's get you some help so that you can really feel good. You deserve to be happy.
Hi, it's Michael Senoff with HardToFindSeminars.com. Thanks for watching this video. Many of my interviews last 30 minutes, 40 minutes, an hour, sometimes even up to 2.5 hours long. They're actual mini seminars, and you've just listened to a short sample of just one of over 117 hours of exciting, hard-hitting, mind-blowing interviews on how to make money in direct mail, advertising, copywriting. I assure you, there is not a resource anywhere on the internet or on the planet that comes close to the free information I provide at HardToFindSeminars.com. So go right now to HardToFindSeminars.com and you'll have free access to 117 hours of audio interviews with typed word-for-word downloadable transcripts and downloadable MP3 files. Please browse some more of the videos or go right directly to HardToFindSeminars.com. Thanks for watching.